A Quebec coroner says racism and prejudice contributed to the death of Joyce Echaquan, a 37-year-old Indigenous woman and mother of 7. She died in a Joliet hospital last year.
We witnessed an unacceptable death, and we must make sure that she did not die in vain, and that we learned as a society, we learned something from this tragic event. It is unacceptable.
To put it very plainly, the coroner believes Echaquan would be alive today if she had been white, and that better care could have prevented her death. She found Echaquan was wrongfully labeled as a drug abuser and difficult patient, despite there being no evidence of that. Echaquan recorded staff making derogatory remarks towards her, racist remarks, shortly before she died. Her death and the footage leading up to it triggered outrage and protest. The coroner also issued several recommendations, the top one being that the Quebec government must recognize the existence of systemic racism within its institutions. Premier François Legault of Quebec held a news conference this afternoon to respond to that report.
The only place where I don't agree is when we say that there's a system, because for me, a system is coming from upstairs, coming from the top people, and I don't see this in the healthcare network, for example.
Ghislain Picard is the chief of the Assembly of First Nations, Quebec-Labrador, and he's in Wendake in Quebec. Chief Picard, thank you very much for joining the program. You've heard Premier Legault speaking there. You know, why is it important to recognize what the coroner says is important to recognize, and that is systemic racism?
Well, because simply there's more and more unanimity around the definition of systemic racism. I don't think anyone needs a law degree to read the report itself and what it says and what contributed to the death of Joyce Echaquan. And she herself concluded, although her death was accidental, that what contributed to her death is also the way she was treated or not treated. Of course, I think one has to read the report in its entirety to really come to the same conclusions. And to me, it really, the position by the government of Quebec and its premier, just adding more, it's really more polarizing the issue here. And definitely, as you might have heard, the family will continue with its legal process and legal recourse to get justice.
You know, I just sort of want to walk through the idea of systemic racism with you, because I hear François Legault, the premier there, talking about it as if the bosses in the healthcare system are, you know, that it requires some higher up saying this should happen and it's a racist policy. And maybe I'm overinterpreting what he's saying here, and I may well be. But of course, systemic racism, we've come to understand, doesn't actually require a specific action like that. Sometimes it's about inaction, and sometimes it's about the very systems that have existed for a very long time. I wonder how you see systemic racism within the context of Joyce Echaquan.
Well, we have a premier that's been referring to systemic racism and this is months ago, saying that what systemic racism is what the Black community experienced in the south of the States. And it seems to be changing his definition as we go along. And to me, it really indicates that you know, they're trying to create a diversion, adding today and referring to the residential school as this is what systemic racism is all about. So to me, we have a premier that, in a way, doesn't want to accept the responsibility, doesn't want to do anything about it. And to me, it really creates more division between the kind of initiative that we could be supportive of as Indigenous peoples in this province. And this is not the only issue. There are many, excuse me, many other issues that where we face positions that on which the government is keeps stalling.
One of the key issues here is, and this the coroner looked at this, the notion that had Joyce Echaquan looked different, that she would have got the care that she needed and potentially life-saving care while waiting in the hospital instead of having the response from healthcare professionals that she got. In fact, the coroner was asked if she thought Echaquan would still be alive today if she was white, and she replied, "I think so." Yeah. And then her husband was talking about this. Joyce Echaquan's husband was talking about this today, and I just want to play that clip here.
Joyce died because she was Indigenous. A woman with 7 beautiful children. Which the most beautiful part of her was used against her.
Do you think when you hear Joyce Echaquan's husband speaking that way, that it's something that resonates with Indigenous people, not just in Quebec, but across the country?
Well, definitely, because we have been focusing on Joliette for the past year, and we just went through the sad anniversary of her death just days ago. But at the time when the story broke out last year, we had said, well, don't just focus on Joliette because the system is at play here. It's really, Joliette is not an isolated case. Look at the whole system and do the repairs that are necessary. And that's where we feel that the government of Quebec is overlooking its responsibilities. You know, from compassion one day, yesterday, to what we witnessed today, it's always a position that keeps changing and keep going back, and that's going back to a position that really seems to be non-negotiable.
Chief Picard, thank you so much for speaking to us today.
Thank you very much.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.